Go ahead.
Good afternoon, ladies and gentlemen. My name is Ryan Milkey. I am the Director of Public Affairs at University Medical Center of El Paso. I'd like to thank members of the media who joined us here today for this very important press conference to share information about the pandemic in El Paso. I'd like to introduce our speakers today. Please feel free, after I introduce them, to ask the questions that you came here to ask, or to stay here until you get your questions answered. And away we go. First, I'd like to introduce County Judge Ricardo Samaniego, CEO and President of University Medical Center of El Paso, Jacob Cintron, Commander Ryan Urrutia. You raise your hand there, Commander. There he is. Where is he? There he is. All right, Ryan, if you want to come on up. What a great name, by the way. Ryan.
Bring your chair.
Yes. Chief Jorge Rodriguez, you want to raise your hand? There we go. And of course, everybody knows Dr. Hector Ocaranza. Before we get started with the questions, our county judge would like to read a letter to all of our media. County Judge.
Thank you, Ryan. We're going to try to do everything possible to let everybody know in this community that we are not a gray matter. We are in a very, very critical situation, and we will be doing everything possible to show the community that we have to have that reset button. We have told you, quite often that how the community responds determines how we respond. And at this point in time, we do need to engage the community further. We need to get our community to understand how critical this is. Remember, we're going into Thanksgiving in a couple, 3-4 weeks from now, and if our numbers are going in that direction, that could be very critical. We've talked about the perfect storm. We've got a situation where we've got COVID numbers going up. We've got the influenza coming at us. We've got those peaks and spikes that we get during holidays, and Thanksgiving is a big family day. So this is not good for our community. And as the county and as your county judge, I really need to step in and try to do the best that we can to stop the spread and make sure that we do flatten the curve. And we are extremely committed. The individuals that are here today, whether Chief Rodriguez, very fortunate to have our CEO from UMC, has taken a tremendous role in helping us in the hospital situation that he'll be talking about and how critical that is. Dr. Ocaranza, of course, has been very educational and extremely dedicated to the entire community. We've got Constable Ugarte here today. Constable Garcia would have been here as well. And of course, we have having Commander Urrutia here is very helpful. So I think the main emphasis is that you need to understand how critical it is as we go forth. I will, as you've known before, I have reached out to the governor, and we've had conversations, and we've tried to do the best that we can to collaborate. I still feel that we could get more of a better relationship going, and that there's more attention here to our community. So this is the letter that I wrote earlier this afternoon, probably no later than maybe 30, 40 minutes ago. So dear Governor Abbott, as you're aware, El Paso is experiencing an enormous surge of COVID cases. Today, for the first time, we reported over 1,000 new cases. Our positivity rate is 14.86%, and our hospitalization rate is 27%. El Paso is facing an unprecedented crisis. Our local hospitals have worked collaboratively and effectively during the pandemic, but their resources are limited. As our numbers surge, however, it is clear that more assistance will be needed. I'm aware that efforts were made to request the use of William Beaumont Hospital to address the surge of COVID-19 cases. I urge you to push for the approval of William Beaumont Hospital as a resource for treating COVID-19 patients. During the October 12, 2020 press conference here in El Paso, you indicated that local elected officials are empowered to do what we need to do to stem the rise of this virus. please be advised that today I have exercised my authority to close county parks, and we are asking residents to minimize all travel outside their homes, limit the number of household residents who visit grocery stores, retail stores, and restaurants. If these temporary measures are not effective, I intend to impose further restrictions. I may be seeking your support for more restrictive measures. The county and the city have remained unified in its approach to the crisis. It is vitally important, however, that I be included in all discussions involving decisions that affect El Paso. It is equally important that our local delegation and Congresswoman Escobar likewise be invited to the table to discuss solutions. This is an emergency situation, and all our local leaders must be consulted. I respectfully request that I be included in your discussions with city officials. I am appreciative of the assistance El Paso has received, and I look forward to continued discussions. So as you could see, we are requesting more help. Just a couple of items that are very important. As I said, we are going to take the role model here as a county on what we believe should be, in every place here in El Paso, a temporary shutdown. That will be up to you. From our standpoints, there's certain things I can and cannot do with the order, but when it comes to our county facilities, I can do that. And we'd like to be a role model for 2 weeks. 2 weeks, that's all we're asking our community. Give me the opportunity to understand what's going on, which way we're going, and what we need to do to address this virus. So we will be shutting down all the parks. We'll be able to do the walking around the parks, but they will be shut down. We will be shutting down the golf course at Escarate Park. We have gotten a lot of comments from business individuals that have taken it on their own to pull back on their own. And I know that I've been told, why is it that a politician or someone in my office has to tell us what we need to do? So here we are. We are asking that you do everything possible. If you know it's not working for you, a family situation, business situation, to pull back. By pulling back, I think that's going to help us tremendously as to what we need to do for the next 2 weeks. The closing of the businesses remain the same. The only difference that I'm really emphasizing at this time, and very emphatically, is that we will ask you to be out of the facility, out of the business of the restaurants or the bars or restaurant bar situations at exactly 9 p.m. This will allow the merchants there to be able to address that situation. It will allow enforcement to recognize that there's no lingering that's taking place after 9 o'clock. So other than that, we're being restrictive in the time being 9 o'clock. You need to be out of that facility. Finally, enforcement is going to be very important. Thanks to Constable Ugarte and Constable Garcia, we begin the training, and we have had more of the law enforcement and the Sheriff's Department that are out there, but we're going to stress that further this coming weekend and the following weekends. I want to remind you that this is not a situation that's brought about law enforcement. We are very respectful of law enforcement, and we do not want to put them in any possible way in harm's way, because we do want you to know that this is a decision that we have taken and we've requested from the police department, from the sheriff's department, and from the constables to be more assertive in enforcement. The one that stands out the most is the wearing of the mask. The wearing of the mask, there will be a $250 fine if you're in a situation that you're not able to be 6 feet away from another person, and if you're not able to be that distance yourself, you will have to wear a mask. A lot of complaints that we have of people walking out of the grocery stores and immediately taking their masks off and interacting with people that are coming in or interacting with people at the parking lot. So as you can see, it's just going to take a lot of common sense, but more than anything, it's going to take the passion of El Paso. that passion that we've seen of El Paso every single time, we're now pleading and asking our community to come together. It's a voluntary shutdown. As the county, we're taking that step as the first to do that. We're asking all non-essential employees for the county not to come in. We're asking all our department heads to be very careful as to who comes in and who doesn't come into work. So once again, for as much as it sounds discouraging, there's always that time when you stop and then you reassess things. And this is what we're going to do for the next 2 weeks. We're at a crossroads that we don't truly understand, and I'd rather stop and reset and figure things out than continue going in a direction that we don't quite understand. So thank you very much. We're going to have some great discussions here. So I pass it back to Ryan, who, as always, from UMC, does a great job. Thank you, Ryan.
Thank you very much, Judge Samaniego. I would now like to turn the mic over to the President and CEO of the University Medical Center of El Paso, Jacob Cintrone.
As we know, this surge is happening nationwide, and so we're seeing it across the country, this increase in COVID infections. And El Paso is no different. And so we now have to really take action to try to minimize the spread of COVID-19 and protect our citizens and our community. I will tell you that the regional hospitals are working together to increase their bed capacity. Hospitals of Providence have added an additional over more than 80 beds to be able to handle the surge. Las Palmas del Sol has added more than 60 beds. We at UMC and El Paso Children's have added approximately more than 80 beds, and then we'll be adding another 80 within the next few days. And despite that, I will tell you that as soon as those beds are open, they're filled. Our EDs are still holding patients awaiting beds, and so this is really a very dire situation. I would say that our community continues to work well together. Department of Public Health, the Office of Emergency Management, our county leadership, our hospital leadership, as well as really the other hospitals and their CEOs have all continued to work together, sharing resources, working together, and looking for ways to be able to provide support to each other so that we can take care of our community need. I will also mention that through the city, the state has provided us a number of staffing support. For example, at UMC, we received thus far recently in the last week 71 nurses, 15 respiratory therapists, 6 nurse practitioners that are coming in tomorrow, 3 doctors, and more to come. We've submitted another request for 25 nurses. They have provided assistance to the other hospital systems as well. Adding a bed is not just simply rolling a bed into a room. That room requires medical gases, emergency power, and a number of other things to support it. But most importantly, it requires people, our nurses, our nurse assistants, our physicians. And so it's very important to keep in mind that as our community gets infected, that rate of infection also affects our staff. And while I consider all our hospital members heroes, they too can sometimes get COVID-19. So we really need to work hard as a community to try to reduce the amount of transmission for this disease. I'd like to also thank Texas Tech. When I talked to Dr. Lang, they're always, as our partners, willing to offer additional support. They've made physicians and residents available, extended hours. A number of other organizations have done the same thing. We sometimes are asked, well, did we see this surge coming? Well, we knew there was a surge that was going to come, which is one of the reasons why we've been working closely with the Department of Public Health in pushing for flu vaccinations, so that flu, which may have similar signs as someone having COVID-19, which is also a flu, to make sure you get your vaccination in order to minimize individuals that may think they have COVID-19, but in fact may simply have the flu. And so we're encouraging everybody to get vaccinated for that. We have had built up our supplies of personal protective equipment at all hospitals, at Border Rack, and at the Office of Emergency Management. We are in much better shape supply-wise than we were back in March when it first hit El Paso. We at the hospitals have built up our supplies of remdesivir, which today was announced as the first FDA-approved medication for COVID-19. And so our hospitals have all worked on building up our testing supply. We've added different methods of testing for COVID-19 that can give us quick results. But all this is fine, and we prepared for that. We've hired additional people in advance of knowing that this was coming. And nonetheless, the things that we see is that when we see such a high surge, those things can quickly get overrun if we don't get the rate of positivity for COVID-19 down. And so we would ask you please follow, safe distancing, masking, and, try to be safe. And as was mentioned with the previous suggestions here and at the city in terms of, how many people go to the store, trying to avoid being out in the public as much as possible, we need some respite for the next 2 to 3 weeks of a slowdown in activity so that hospitals can take care of the patients they have and get them home safely, and so that we can continue to gear up. We think this winter is going to be very busy, not only with the flu season coming in, but also with a surge in COVID-19. We have a lot of people working here very hard, our nurses, our doctors, our staff, and many are working extra hours. Many are coming to the hospital when they may have concerns about their own family safety. Nonetheless, they're there sacrificing and working hard. The public health staff, the Office of Emergency Management are doing the same. So I will tell you that all these groups have worked really well together, coordinating our activities, not only here locally, but in coordination with the state and in trying to get more resources from them, which Governor Abbott has committed to. But all this is for naught if we, the public, don't take those extra precautions, at least for the next few weeks, to try to limit interactions, always have your mask with you, and always maintain a safe distance. If we could do this for the next 2 to 3 weeks, we would then hopefully see the positivity rate begin to drop. Thank you.
Thank you, Jacob. I will now turn the mic over to the foremost physician and information resource in our city, Dr. Hector Ocampo.
Good afternoon. And I would like to add and emphasize that we're in a critical situation. We cannot say it enough for people to understand that we continue to see a lot more people getting sick. We continue to see our loved ones being affected by this pandemic, and we don't want to see the suffering. We don't want to see how families have been shattered by complications and death from the COVID-19. Our hospitals, as Mr. Cintron has said, we've been working together between the city, the county, the public health, Office of Emergency Management, hospital community to prepare for this and continue preparing for what is coming. We were expecting that another surge was going to come, but we thought it was going to be coming a little later than now. But now that we have it, we all need to participate, and we have asked the community to come together, and everybody participating in staying apart. Being close sometimes means that we need to stay apart. We need to do that very simple interventions that we have stated from the beginning of the pandemic, which is 3 very important things. One is wearing your face covering or wearing your mask. The second one is going to be the social distancing. And the third one, the hygiene that we all need to be observing. By doing this, it's going to take us long ways. And we didn't learn about this just with the COVID-19. We learned it from many, many, many years ago when we had the Spanish flu pandemic, where the medications and the amount of medical care was not up to par to what we have right now. So we know that for the COVID, we don't have a medication. We recently got approved the remdesivir that we know that it's going to be helping those that are in dire need, that are in the hospital. We know that the vaccine is coming, but in the meantime, we need to do something, and this is what we need to do. We've had, in the last 3 weeks, an increase of over 10,000 cases of COVID-19 in our community. Our positivity rate, as we have heard, went from 9.4 at the beginning of the month to 14.86 It is a very staggering number, how we see that more people are coming to get tested because they have symptoms, and the asymptomatic initially was about 25%, meaning 1 out of 4 people did not have any symptoms, and now it has continued to drop. So we're knowing people that have had those symptoms of COVID-19 that it might not just be the very severe problems breathing. It's going to present with a coughing. It's going to present with a runny nose, with a fever, with body aches. And more we know about exposures that are closest to our house. The cases per capita have grown in about a month over 5 times. Initially it was 14.8 per 100,000 on September 21st. And by the end of the month was 26.6, and right now yesterday was 72, but now it has grown to over 80 cases per 100,000, which is 5 times in a month or more, 3 or 4 more times in just 3 weeks. So that is alarming, and that is something that we do need to participate. We cannot be deaf to those that are suffering, and we need to make every single effort to stop the spread of the virus. Some of the interventions that we have recommended are strong recommendations to Judge Samaniego, to the city with Mayor Margo, was initially, since we saw that very large number of people were young adults, and we know that our community are built on young adults, but they go to work and they want to gather, but we need to prevent those gatherings, and that's why closing those restaurants by 9 o'clock is going to help us avoid some of those gatherings that were happening. If everybody participated, and instead of taking the whole family to go shopping, please have only one person carry out those essential activities. That's going to protect our loved ones from getting infected, not just from going out, but from being in contact with many other people that are doing the same. Keep your mask in place, and keep it the right way. We're not going to be doing anything if we keep it under our nose or under our chin that is not going to help protect others, and the others are not going to be able to protect us. We all need to protect each other in such a way. The testing has been increasing because of the demand that we have, and we have been able to expand all the testing, and Chief Rodriguez is going to talk more in detail about the testing and how it is being deployed. Many other options and many more tests that we need to do in order to find those that are positive so we can isolate and quarantine them. For those that have tested positive, please remain at home, and everybody in your household, tell them to stay at home as well. We know that it's hard to stay at home, but any relatives can bring you all the necessities that you need so you can complete all the time, and this way we're going to be breaking the cycle of exposure and getting infected further ahead. Our hospitalizations has increased very drastically. The last peak that we had was in July, and we had approximately 28% of hospitalization. Now we're over 38% of hospitalization. It continues to increase to a point that we are saturated. Hospitals are working very diligently in deploying all those plans that they have for surge capacity and trying to expand the beds so they can care for our loved ones that require higher level of care. The same way they're expanding how they're going to be taking care of those patients that need ICU care, and how, not just for COVID-19, but for any other reason, because a lot of the people have not gone to seek care because they're afraid that they're going to get infected in the clinic. They're afraid they're going to be infected in the hospital, but that is not the place that you're going to get infected. Those people, sometimes they have diabetes, high blood pressure that is not very well under control, and we do need to make sure that they're well controlled, they have enough of the medication, and that we're taking care of them in such a way. It's been more than 10 days that we have surpassed the threshold that Governor Abbott set up for all the trauma service areas, that it was about 15%. We have passed the 15%, and we are way over 28% of the hospitalization for the entire region, which includes El Paso County, Culberson County, and Hudspeth County. Hospitalizations at the peak in July was in the number of 308, but now we have surpassed the 500 hospitalizations for COVID-19, which is more than 50% above what we saw in July. Most of the people that have been hospitalized are older than 60 years of age. We know that they're not out in the evenings doing other activities, but we know that these loved ones have been affected by some younger ones that expose themselves and bring the virus, and sometimes they don't have many symptoms, or they may dismiss some symptoms as being allergies or other condition that they think is not going to pose a risk to those. But unfortunately, they get infected and end up in the hospital or sometimes passing away. We're expecting that we're going to be seeing more deaths due to complications of COVID-19 because as we see positive cases, we see an increase in the hospitalizations, and then we see the increase in the deaths due to complications of COVID-19. So please, we need to do it for ourselves, for our loved ones, and for our community as well. On the contact tracing that has been done by public health in the last 2 weeks, we know that 37% of people have reported visiting stores. 22.5% have reported eating at restaurants. 19% reported travel to Mexico. 10% attended parties, reunions. 7.5% attended gyms. And 4% attended larger gatherings. We do need to avoid those opportunities. And because of this data that we have, we need to intervene at such a level. And that's why county judge has pleaded all the community to take a rest, take a moment. Let's step back and do it voluntarily. Stay at home. Basic indication and basic recommendations that we have that many people may take for granted. But again, those are the ones that are going to help us get out of this critical situation. And with that, I thank you.
Thank you very much, Doctor. Our next speaker would be Chief Ryan Olivia.
Good afternoon. I'd just like to discuss a few of the points that everybody up here has already made. We're at the point where law enforcement didn't really want to be in, but now we're here to where we need to take action, and they called upon to take action. These county orders are in place, and deputies within El Paso County law enforcement are available to respond to these calls. This is the orders are available on the EP Strong website or on the El Paso County website if you're unfamiliar with them. Mask violations are up to $250. Violations of businesses or any other parts of the order, home gatherings and so forth, are fined up to $500. Like we said, we want this community to come out of this better and stronger and healthy. We're not going in that direction, and law enforcement is now having to be called upon to intervene. Like I said, our community is a very strong, resilient community. We're a very proud community. We're a very caring community. We're hoping this community again will come together, hear the call from public leaders, and slow down your activity, maintain your social distance, be careful when you're out, stay healthy, and we'll all be back to some normalcy at some point in our life, but we're all going to work to get there.
And I would like to hear from our Fire Chief, Jorge Rodriguez.
Good afternoon. I want to thank you and thank the judge and Jacob and, of course, Dr. Carranza and Commander Yuteria. So one of the biggest drivers that we see for testing is the level of community spread that we've seen from this virus. When we first began our original testing back in March 23rd of this year, we were doing about 300 tests per day. A lot's changed in the last 7 months. In the surge and spike that we've seen recently, there's been a significant demand for testing, as you all are well aware. So within the last 48 hours, we've stood up 3 additional state sites. Working with the University of Texas at El Paso, we opened up a mega site there at UTEP, working with the Texas Department of Emergency Management contractor HANU. They've been very responsive, so that went live yesterday. Great turnout from the community, so we continue to urge the community to take advantage of that resource there at UTEP. We also opened up 2 additional sites with the Texas military. The one that went live yesterday was at the Eastside Sports Complex. That one has a capacity of 500 per day, the UTEP 1,000 per day. And this morning, working with Region 19, again, great partners. It's just it's amazing how we come together as a community to help out in any way we can. So they offered their facility. This is at the Region 19 Kenworthy Complex in Northeast El Paso, working with the Texas military that is going to offer an additional 500 tests per day. So in total, in the last 2 days, we've brought forth an additional daily capacity of 2,000. We reached a few milestones in testing. On Tuesday, we hit 6,100 tests. That's our highest we've reached in a single day. To give some perspective, using our CDC week total for last week, we did 32,000 tests. At the rate that we're going this week, not only are we going to surpass 8,000 tests per day, but we're going to surpass that 32,000 by week's end. So there's a significant demand for testing, again, when we see a spike in cases. But that's just a great indicator to let you know that there's people that are concerned that they have been exposed. So the masses that are going out to get tested is just really a good indicator of showing you how bad the situation is. So like the judge and everybody else here has mentioned, we're really asking the community to take these 2 weeks to take a moment, allow the city and the county to work to bring the additional resources into the hospital community, and for all our first responders and everything else to ensure that we put and we can flatten the curve. So one last item I do want to mention, and I want to thank again Judge Samaniego, Ms. Keller with the county and their sheriff's office. We're going to be bringing in, working with the Health and Human Services at the federal level. We're going to be bringing down an additional testing site. This is a surge testing site that they're already pushing 30,000 tests, and tentatively will be open next Wednesday. So that's going to be one additional site, a lot more capacity. It's going to be completely self-sufficient. It's not going to draw from our local resources here, and that will go live in Escalante Park next Wednesday. That's our tentative opening date. So with that, I'll pass it back to our facilitator. Thank you. To Ryan.
We'll go ahead and take any questions from the media at this point, and when the commander has to respond, we'll come behind you. Who wants to be first? Go ahead.
Can you elaborate a little bit on the mask enforcement? You mentioned you talked about how, you would take your mask off when you walk outside the gathering. Is that something you come out and possibly not
Yes, we're looking at definitively what are some of the things that might be creating issues, and we also listen a lot to the public. We have the 20/80 rule right now. We have 80% of the people doing what they need to do and 20% not, and that's creating a little bit of friction. So you've got someone going in, wearing their mask, someone coming out, taking their mask off as they're coming out. We're obviously, on those smaller things, we're going to do warnings. It's more about compliance. It's more about education. It's the bigger ones that I think that law enforcement are going to be a lot more active, which would be if they saw, 5 to 10 cars out somewhere, or they're out partying in the desert or doing something that is obvious. That's where I think they're going to be much more active. On the masking, they're going to approach people that are able not to be within 6 feet and not wearing their masks, and that'll be a $250 fine.
President, we're talking about trying to hold back county facilities. Can you talk a little bit more in detail about that? Do you have a timeline for the facility? I know you were talking about Escalante and other places. Can you get into details? Because I'm sure a lot of people, they have business with county.
Yeah, absolutely. Our parks, we've remained, our parks have not always been open completely, and we shut down a lot quicker. Escalante was a little bit more active, but we are getting a lot of groups that are there. And we don't want to show any favoritism of doing one thing and not the other. And so as county, we are closing down the parks. Like I said, you're able to use the around the circumference to walk and so forth. You will be able to fish because that's more of an individual situation, but everything else will be shut down. And as far as the county, we function the way we do. All the services are still available, except we have a lot of support from individuals that can do it from home. We were bringing them back in a little by little, but then to be that role model that we've talked about, we're now pushing back and saying, you know, if you're not an essential person or we could do things from home, we are going to go in that direction. And it'll be tonight, tonight at 12 o'clock will be effective at that time, and it'll be a 2-week period. And the 2-week period is to see how are we going to enter as we get into Thanksgiving. If those numbers are really high, we'll maintain it. If they're going down, then we'll make a decision at that point in time.
Yo tengo una pregunta. Se ha hablado de la cancelación de deportes aquí en la comunidad. Sin embargo, tenemos el equipo de users, tenemos los locomotores. ¿Se han tenido pláticas de tal vez de una forma u otra tratar que no haya tanta gente o disminuir el número de personas que van a este tipo de eventos?
Es una excelente pregunta porque son cosas que el gobernador puede determinar y lo que es profesional, ellos están excluidos de la orden. Entonces yo no puedo intervenir en esas áreas. En realidad yo puedo más intervenir en las áreas que pertenecen al condado. Si no pertenecen al condado, entonces yo no puedo intervenir. Por eso en la carta le estoy pidiendo al gobernador, ya nos dio ciertos privilegios, pero estamos pidiendo que nos dé más en caso de que siga subiendo. No podemos ignorar que vamos en una situación muy crítica.
¿Puede hablar de las multas? Sé que lo hice en inglés, pero en español para la audiencia hispana.
Sí, lo que ahorita la mascarilla es lo que no vamos a reforzar muchísimo, sino que no sea más educativo. Es de una manera de llegar con la persona y presentarle de que necesita usar la mascarilla. Pero ahí va a ser $250. Si es que no toman la sugerencia, la dirección de ponerse la mascarilla, va a ser $250. Y no sé si, Urrutia, quisieras hablar en español sobre las multas de los negocios para estar más específico. ¿Perdón? Ok. Él le va a dar comentando. No quiero meterme en la área de que ellos van a estar reforzando durante el fin de semana. Disculpe la pregunta.
Que si nos podría repetir en español que las personas no esenciales vuelven a regresar a trabajar a casa.
Sí, lo que estamos haciendo, el condado sí podemos nosotros exigir ciertas cosas. Estamos preguntándole o pidiéndole, tratando de exigirle, pero de una manera muy amable, de que la gente que no tenga que salir no salga, que se queden en la casa, que si van a ir al mercado, que vaya una persona, es ser más sensible de que más personas, más las posibilidades ahorita del contagio, ¿verdad? Es muy difícil con tanto estas personas positivas, las probabilidades van a subir muchísimo si hay más gente que están relacionándose en la comunidad. Entonces le estamos pidiendo de que por favor, ustedes recuerdan que quédense en la casa, sean seguros, trabajen de la casa. Queremos regresar allí, pero en esta ocasión va a ser voluntario. Le estamos pidiendo. En el caso de nosotros sí estamos haciendo un poco más, vamos a exigir un poco más de cerrar los parques, de nuestros el personal que no necesita estar en el condado, en las oficinas, que trabajen de la casa. Gracias.
So in regard to testing, just like we reiterated, we were already had several mega sites already in place prior to the 3 additional that we added. We also had the Nation Stolman location. The city added an additional site to the west side earlier this month. So we've been adding capacity. We've contracted with additional labs to be able to process as much testing we can here locally, and also expanding our partnerships with our private partners, clinics, working with the schools, so they have the capability to test within the school system, which is a model that hasn't been replicated throughout the state. So it's very cutting edge. So we've taken a lot of initiative to try to expand testing as much as possible within the community, and we continue to do so. So the fact that we were able to provide additional testing within 48 hours and bring 3 additional sites to address the surge and bring in an additional asset coming in from the federal government next week is going to provide that coverage.
Also, in regards to the contact tracing, we have 270 contact tracers, and we have partnered also with UTEP with the help of the state so they can continue providing an expanded contact tracing activities and capabilities. As we have more cases, definitely we need to continue doing the contact tracing. And also, one thing that is extremely important that we have asked all the physicians and medical providers in the community that are doing the testing is to inform to those patients that become positive how they need to be isolated and quarantined and that they need to be remaining there, but also to provide those results to us so we can continue doing the monitoring and provide the release of isolation. For those that are non-compliant, we are hand-delivering the health authority orders in which they're delivered by a Department of Public Health official and a peace officer of police department to hand-deliver those orders, in which he will come with legal consequences if they choose not to adhere to the order.
May I add quickly that this is where we're asking the community to participate. And one of the things that's happening is that, and I was able to do a tour of and talk to the contract tracers, and that they're not getting their calls back. They're hanging up on them. They don't open the door. Unfortunately, there's a lot of, they're disingenuous in saying what really happened. So that, I want not to be blamed on the fact that we're not doing enough contact tracing. The problem is when they're not cooperating, it's very difficult for them, and it backs up the people that they have to see when they struggle to even get someone to call back. And so it's a combination of we need to do more of it, but the community also needs to be okay. Nothing's going to happen. You tell the truth. It's going to work out great for everybody. We'll find out where the situation is, and we'll have better numbers if everybody cooperates.
As you talked about more enforcement, I'm curious if this is like, you're talking about more enforcement in the county, is this also included in the city? And also, how about the unincorporated areas reference? So you make sure that the enforcement out in private or how does that work?
Well, actually, in the unincorporated areas is where I have more jurisdiction. But we are being able to enforce all over the city and the county. It'll be equally done, whether it's a bar or restaurant in the county or the city. We're treating the entire county in the same particular way. So we're not discerning one from the other.
How about fines for, let's say, for example, businesses that stay open after 9? What happens to that?
Well, we agreed it was $500, right, Commander Urrutia?
Excuse me, the mask violations are $250, and the business violations are $500, up to $500.
Okay, go ahead.
So, your recent issue reports that in 3 weeks, ICU beds, we just talked about how we're getting more equipment in beds. What's the contingency to continue to serve
So, for example, the various systems, we have so many ICU beds, and clearly with the surge that we've seen, we've used all those ICU beds up. So we've opened additional ICU beds. So, for example, at UMC, we had a total of 77 ICU beds. We've added an additional 38 more beds. that are critical care. We're opening up some additional beds later. And, you know, a critical care bed is not the same as a regular bed. You need special equipment, special beds, certainly a different type of provider, more of an intensivist. So we have been increasing the number of beds. We had a contingency plan back in April as these things were going. Various hospitals did. And so we're just simply following that contingency plan. We've had to accelerate some of that because of the number of individuals that are coming up positive that need hospitalization. But we have opened up regular beds and for COVID patients as well as critical care beds for COVID patients. And, you know, what happens if, for example, every hospital runs out of critical care beds? So that's where the judge and the mayor are both working and trying to see about being able to access additional services. As an example, William Beaumont might be an opportunity to be able to use them. There's a possibility of mobile hospitals. You know, certainly Governor Abbott has sent and is continuing to send physicians, nurses, and other specialties to assist. So, you know, basically that's where we're at. So we need to continue to grow. Are we able to grow with no limitation? There is a limit. And that is why it's very important that we focus on trying to reduce the number of individuals that are COVID positive. We talk about the numbers, but every number represents a person. And we've seen people that didn't worry about it before and now see that their lives may be at risk, or they may have lost a loved one or may have lost their own life. And all because of a failure to take that precaution and try to self-isolate or mask. And so knowing that we have a limitation, even with the help we're getting in from the state and others, we're trying to make sure we try to slow down that surge pickup to allow us to be able to take care of the patients we have and to slow the rate of infection. Keep in mind, this doesn't even end here. As I mentioned before, we're working on flu vaccination. There are protocols that the state has that deal with when a vaccine is approved. And keep in mind, this is a challenge until there's an effective vaccine. Once we get an effective vaccine, I think I'll rest better. But the reality is my belief is even if we had a vaccine that was effective in November, it may be well into 2021 before everybody has access to it. But even then, that coordination we have with the hospitals, the public health department, and others will continue because we then have to start working on not just COVID testing, but then once the vaccine or vaccines are developed, also applying the vaccine to our population. So we're not out of the woods yet, and the resources are finite. You can't, you don't want to look at things like, well, we're going to open up a civic center, we're going to open up some other place because the resources there, as much as we'd like to think, are not going to be comparable. So the more we can do to try to limit exposures and get that under control, the better it is for our city.
Just let me add that I think we've anticipated more than people give credit, especially in the hospital situation. Cintron and his team have worked months and months ahead of time. I said I would be very candid, and sometimes people don't get the message, but I'm going to tell you right now that we're actually having to work with funeral homes because we're expecting that number of deaths. And I think that puts it in the perspective of how difficult the situation is and how sad it is when you're already making arrangements with funeral homes to help us with the morgue and the medical examiner's office. And like I said, I'm going to be candid. It's some things you don't want to talk about, but this is a reality. But we do anticipate quite a bit more than people really realize what OEM has done, and Chief Rodriguez and Dr. Carranza, a lot of moving parts. So I just hope that people don't look at what we don't, but where we are, where we came from. So thank you for allowing that to happen, to understand it from that perspective.
If I can add a comment to that. So one of the things that we did anticipate early on was we knew that flu season was going to be a major impact in the community. It traditionally is year after year. So working with the Department of Public Health, Office of Emergency Management, partnering with UMC, like Mr. Cintron said, we've purchased 133,000 flu vaccines, We've done 20,000 to date, and we launched our flu vaccination in October. So we're well ahead of what we've ever done in terms of flu vaccinations within the El Paso community. So all of that's happening in the background to what we're currently dealing with, multiple operations and working with funeral homes. There's a lot of actions going on in the background that is, again, looking ahead, anticipating what the needs are going to be, and yeah, that's just part of the ongoing plan we've had.
Are there any other questions? Ladies and gentlemen, thank you for coming to our press conference. I hope you have a great and rest.
Thank you. Be safe.
Thank you.